We start from general examination of the abdomen. In normal case, the patient's abdomen should be round-shaped, symmetrical, participating in act of breathing. Also in the abdominal area, there shouldn't be vascular asterix and jellyfish head. We ask patient to raise his head and tighten his abdominal muscles. No visible discrepancies of the abdomen and hernial formations were identified. In order to define painful areas, lipomas, and different types of hernias, we provide superficial palpation. We divide patient's abdomen into three parts: epigastrial, mesogastrial, and hypogastrial. Then we ask patient to rise his head and stay in this position so that we can see his straight muscles. We provide a line. Afterwards, the patient's abdomen will be divided into 9 areas. So we ask patient to bend his knees and we start the superficial palpation from regio iliaca sinistra, regio iliaca dextra, regio abdominalis lateralis sinistra, regio abdominalis lateralis dextra, regio hypochondrica sinistra, regio hypochondrica dextra, regio epigastrica propria, regio umbilicalis, and we move to regio suprapubica. The abdomen should be mild, painless, without lipomas, hernias, and muscle tension, which is evidenced by the following. We ask patient to rise up his head, define his straight muscles, and by the white line we check the presence of hernias by pushing on the line, and we check the muscle tension. After that, we define the symptom of Schottgen-Blumberg, which is manifested by a sharp increase in abdominal pain with the rapid removal of the palpating hand from the anterior abdominal wall after pressing. Then we move to the deep palpation of the abdomen. We draw a visual line from umbilical ring to the iliac bone, and in the middle of this line, we make a skin fold towards ourselves. We ask patient to breathe deeply, and by 3 steps, we dive our fingers to the abdomen. Then we move hand forward and backward to observe the intestine. Then we move to the cecum and do the same algorithm on the right side. The diameter of cecum and sigmoid colon is 3, 4, and 3 centimeters accordingly. The consistency of cecum is mild, while the consistency of sigmoid intestine is dense. They are both painless. The absence of rumbles with sigmoid colon and the presence of rumbles in cecum should be observed. They are both smooth, cylindrical in shape, and movable. After that, we move to the deep palpation of transverse colon, where we firstly define the lower border of the stomach by quiet percussion along the white line. After finding the patient's stomach lower border step, we back downwards for 2 centimeters and provide deep bilateral palpation. The skin fold is done forwardly. Normally, the colon transversus isn't palpated. Then we move to colon ascendens, where we carry out bimanual palpation. We put our hand under the corpus of the patient on the right side. We provide a line by the straight muscles, then step back into 2 centimeters to the right and put our hand horizontally, and then we start to palpate. We do the same thing on colon descendens from the left side, and the diameter of colon ascendens and colon descendens is 2 centimeters accordingly. The consistency is dense, elastic. They are both painless, not rumbling, smooth, cylindrical in shape, and movable.